Hey everyone, I'm here to answer the question today that I get all the time. Everyone wants to know what's the difference between manual physical therapy and regular physical therapy. And I'll tell you real briefly, real simple, here's the biggest difference. Manual therapy, to be a manual therapist, you have to get special training. It's advanced training beyond your physical therapy degree to be able to learn advanced soft tissue techniques, myofascial release techniques, joint popping techniques, what we call joint manipulation. All these techniques are not mainstream taught in physical therapy school. So a manual therapist would have gone through extra training to be able to get the credentialing to say that they're a manual therapist. And what we know in the research is that manual therapy plus specific exercise gets way better outcomes as far as physical therapy rehabilitation versus just exercise alone or even manual therapy alone. So, even though we call ourselves El Paso Manual Physical Therapy, we're not just doing hands-on. Every client leaves us with an exercise or two that they need to do, and we stress it big time. They need to do that to be able to continue to get better. The hands-on part is just to boost the recovery, get you feeling better today, and then the exercise part is to make sure that you're feeling better for the long term, really forever. We want to make sure we cure your condition. But a common technique that people get here are joint popping techniques. We're trained in popping joints in the neck, low back, mid back, shoulder, elbow, wrist, hand, knee, hip, ankle, foot. Pretty much every joint in the body, we can pop it in many, many different ways. That doesn't mean everybody gets this technique, but it's something that we commonly give out. We also do a lot of hands-on soft tissue work if that's indicated. And then there's a small group of clients, usually some that have very chronic pain, that we don't actually do any hands-on techniques on them. We have advanced training in exercise as well. That's part of the manual therapy fellowship training that I have, so that we know how to handle those patients that have advanced neurological problems, fibromyalgia, autoimmune issues that hands-on treatment may not do so well with it. And so we start off with hands-off treatment, mainly exercise-based, and then if possible, if indicated, if it's necessary, we progress them into using hands-on techniques to make them feel better a lot faster as well. Regular physical therapy tends to be exercise-based. They will use hands-on techniques as well, but they just won't get the same kind of training. If all they've gotten is physical therapy school, they won't get the same kind of manual therapy training that you would when you're going through a manual therapy orthopedic residency or fellowship program. So in a nutshell, that's the difference between a manual therapist and a typical physical therapist. Thanks.